We would like to welcome you back to school for second semester. This video is a reminder for all stakeholders on important prevention measures to prevent the spread of COVID-19.
It is important to know the facts. There are simple things you can do to help keep yourself and others healthy. Wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing, or sneezing, going to the bathroom, and before eating or preparing food. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Keep track of your symptoms. For most people, the immediate risk of becoming seriously ill from the virus that causes COVID-19 is thought to be low. Most people have mild illness and are able to recover at home. If you think you may have been exposed to COVID-19, contact your healthcare provider. If you have an emergency warning sign, including trouble breathing, get emergency medical care immediately. Some people may have an increased risk for more serious complications from COVID-19 and should take measures to protect themselves. Someone who has completed quarantine or has been released from isolation does not pose a risk of infection to other people. For up-to-date information, visit CDC's Coronavirus Disease Situation Summary page. People with COVID-19 have had a wide range of symptoms reported. The symptoms may range from mild to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms which are not attributed to another health condition may have COVID-19, fever or chills, cough, shortness of breath or difficulty breathing, fatigue or muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea. This list does not include all possible symptoms, and the CDC continues to update this list as they learn more about COVID-19. The virus is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs when people are in close contact with one another within about 6 feet. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. This is not thought to be the main way the virus spreads. COVID-19 may be spread by people who are pre-symptomatic or asymptomatic, not showing symptoms. Frequent hand washing can keep you healthy and prevent the spread of germs from one person to the next. Follow 5 steps to wash your hands the right way. Wet your hands with clean, running water, warm or cold, and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Rinse your hands well under clean, running water. Dry your hands using a clean towel or air dry them. Hand sanitizer, that contains at least 60% alcohol, can be used if soap and water are not available. It is important to sanitize hands often, especially after blowing your nose, coughing, or sneezing. After using the restroom. Before eating or preparing food. Before or after touching your face. Before putting on or removing your masks. After touching high-touch surfaces, doorknobs, handrails, computers, etc. Hand sanitizer, that contains at least 60% alcohol, can be used when soap and water are not available. How to use hand sanitizer. Apply the gel product to the palm of one hand. Rub your hands together. Rub the gel over all the surfaces of your hands and fingers until your hands are dry. This should take around 20 seconds. Wash your hands with soap and water as soon as it becomes available. Covering coughs and sneezes and keeping hands clean can help prevent the spread of serious respiratory illnesses like influenza and COVID-19. To help stop the spread of germs, cover your mouth and nose with a tissue when you cough or sneeze. Throw used tissues in the trash. If you don't have a tissue, cough or sneeze into your elbow, not your hands. Remember to immediately wash your hands after blowing your nose, coughing, or sneezing. Social distancing, also called physical distancing, means keeping space between yourself and other people. To practice social or physical distancing, stay at least 6 feet, about 2 arm lengths, from other people. A minimum of 10 feet will be maintained during all physical activities, and group size limitations must be followed as defined by the CDC, VDH, and VDOE under the phase guidelines in existence at the time of the activity. Face coverings are required at all times while inside the school building. Cloth face coverings were made available to staff and students. Cloth face coverings are meant to protect other people in case the wearer is unknowingly infected but does not have symptoms. Employees and students K-12 are required to wear cloth face coverings while inside the school building and on school transportation. Failure to comply with the BCPS health plan and/or not wearing a face covering during required circumstances could result in the student changing to 100% remote learning. Please speak with your administrator if you have additional questions. Wear your face covering correctly. Face coverings must fully cover your nose and mouth and should fit snugly against the sides of your face. When you remove your face covering, be careful not to touch your eyes, nose, and mouth when removing the face covering. Wash your hands immediately after removing a face covering. It is important to wash your face covering after each use. All BCPS students and staff are required to monitor and self-screen for symptoms of COVID-19 before reporting to school each day using the BCPS Student Daily Screening for COVID-19 log. If you answer yes to any of the questions, you must stay home and follow established procedures for reporting your absence. Temperature checks will be conducted at the school sites upon arrival. It is very important that you conduct this daily self-screen documentation at home prior to reporting to school each day. If you have questions, or need an additional copy of your screening log, please contact your school administrator. Staff and students should not come to school if they are sick with COVID-19 symptoms, test positive for COVID-19, or have been exposed to someone with confirmed or suspected COVID-19 symptoms. Students or staff who arrive at a school facility and report feeling ill or who are displaying COVID-19 symptoms will immediately be relocated to a designated isolation area. The student or staff member with signs of illness of COVID-19 symptoms will not be permitted to remain on school premises. Individuals who are sick will be required to go home or report to their healthcare provider, HCP. The symptomatic student will be required to keep their face covering or mask on and sit in a separate area from all other staff and students until he or she can leave the premises. A designated staff member at the school will be contacted to provide care to the staff or student. The designated staff member will maintain social distancing while monitoring the symptomatic staff member or student until he or she can be safely transported home or to a healthcare facility. School personnel will implement cleaning and disinfection procedures of areas used by any sick individuals. Cleaning and disinfecting protocols established by the BCPS Director of Operations will be followed. Designated school personnel will inform the school administrator and Julie Baker, Director of Special Education and Human Resources, for further direction. Thank you for watching. We are committed to the safety of our students, employees, parents, and community members. We appreciate your support this coming year as we work together to provide the best environment, educationally, emotionally, and physically for our school. In the months to come, Botetourt County Public Schools will continually monitor the pandemic circumstances and adjust school practices following the guidelines set forth by the CDC, VDH, and state and local officials. We will work to keep you informed of any changes in practices, policies, or procedures. If you have additional questions, please ask a teacher or administrator. Additional resources can be found on the CDC, DOLI, VDOE, and VDH websites.